Hi, welcome to another educational webinar brought to you by Fullscript. I am Dr. Holly Lucille, part of the Integrative Medical Advisory Team here at Natural Partners Fullscript, and am delighted to introduce the webinar today, Breast Cancer and Surviving and Thriving, I should say, through treatment with the illustrious and wonderful Dr. Lisa Price. Dr. Price, thanks for being here.
Thank you. Thank you for the introduction, Dr. Lucille.
Yeah, I've heard about you, and I'm so excited to talk to you because your niche and the whole title of this webinar is sort of exciting. You know, when I was first a graduate from naturopathic medical school, you know, one of our principles is dossier, right to teach, and I think one of the things that I taught all the time was, what the heck do we do, right? And I would often use conventional cancer care as an example of how it's such a marriage with more alternative care, like I was taught to provide, because, you know, as you well know, and we're going to get into this, sometimes cancer, obviously a very devastating diagnosis to receive from anybody, but the conventional care can be pretty intense on the body. And I always was one to just say that, look, as a naturopathic doctor, it's where we step in the most. We can protect the body and the cells that we don't want to have stop dividing, et cetera. So I'm very excited to talk to you. Just a little housekeeping regarding the webinar, folks. Please feel free to use the chat box when you have questions for Dr. Price. There'll be Slack to me, and then we will make sure that we get to all of your questions. And if we don't in the time allotted, we'll make sure that those answers are out there. Also, just know that you are going to, if you're participating live with us, you're going to have a chance to receive a copy of Dr. Price's book, and we're going to talk more about that. So, Dr. Price, just a little bit about you. You are a licensed naturopathic physician with expertise in complementary cancer care and culinary nutrition during cancer treatment through survivorship. You guide patients in finding the best foods and supplementation during cancer treatment that reduces short and long-term effects of conventional treatment, as well as advising on which supplements and foods to avoid. Very important too, because there are, of course, some contraindications there. A National Institute of Health Research Fellow from 2005 to 2007, Dr. Price is also an author, a radio host, a lecturer, and adjunct faculty member at Bastyr University. She studied microbial biochemistry, I got that right, as an undergraduate, and as a Master's of Science student in New York, and then graduated from the prestigious university, Bastyr, in 1998. So thank you once again for all of your work, for what you do, and most importantly, for being with us here today.
You're welcome. Thank you for that. Yeah.
Yeah. Okay. So that was just a little bit, and I think it's always interesting when I get a bio, because I know that you are so much more than anything on this little piece of paper that I have. So tell the participants more about yourself, and especially how this path through your very illustrious studies you got to complementary cancer care.
Yeah. So it's been an interesting road. It was definitely one of those, oh, I would never do that type of roads. So yeah, let's start in upstate New York, where I went to a school for environmental microbiology and environmental biochemistry. And at that point in time, I was doing research on the bioremediation of lignin and cellulose, trying to look for a bacterium that we could use to put in on beads to help degrade waste products. So I was really very interested in helping to prevent lots of waste products and toxins and xenobiotics from being sent down into the waste, into water, where it could affect human beings. So at the time, that's what I was doing, and I eventually started working with not just bacterium, but also a fungi called Phanerochetochrysosporium that was doing the same thing. I went to a forestry school, and I didn't pick it because it was for forestry. I picked it because it was for environmental biochemistry and microbiology. And you know, I had a lot of folks ask me, oh, that's interesting. What are you going to do with that? Apply to medical school? And I said, oh, no, I really enjoy working with my bacteria, putting them back in the incubator at night. They don't talk back. I do have conversations with them, but they're always pleasant. and so I never thought about working with people, but there is an innate passion that I have and concern that I have for the environment and the environment's effect on people's health and well-being. So around that same time, I became very active in social justice and also environmental justice movements on campus. And so it began to everything began to synthesize together. I moved to, after I finished graduate school, I moved out to Seattle to await for Peace Corps. I had been accepted in Peace Corps in West Africa. I was going to be training in Togo and then had been stationed in Benin. And I kind of looked around Seattle and I said, what in the world are all these people using? What is this thing called naturopathic medicine? Now, either they're it's just some woo-woo that people really like to use and spend their money on, or there's something to this. And especially with regards to how the interaction between medicine and environment and has on the effect of people's health and also well-being. And so it intrigued me. I wanted to know, did it work? As a scientist, the question was, is this effective and is this functional? Does this work? The other thing is that I come from a really long line of hypochondriacs, so it really would work for me if it was true. So I went into the Peace Corps, came out, and I still had the questions, the burning questions. Not wanting necessarily to work with patients, but I still had the burning questions of this. And so I eventually made a plan to eventually become a researcher in natural products, but looking at it from the naturopathic standpoint. And the only way that I could do that was by going to, at the time, naturopathic school. So this was in the early 90s. And so I applied for Bastyr. I got accepted. And, my thought was finish my 4 years, because back then it was a torturous 4 years. And then I was going to stand and wait for the NIH to come in, or the National Institutes of Health to come and give me a grant. Well, finished the 4 years, but it took quite a while I got a grant, a T32 research grant from the National Institutes of Health in 2005 to 2011. And studying
I want to, Dr. Price, don't mean to interrupt you, but I want to chunk it down because I want to ask you so much more about that research.
Okay.
For sure, but when you go
from how I got into it.
Yeah, I love it. So, but when you go from environmental biochemistry into this sort of, cancer care, connections are there? Do you see them?
Well, the connection is one that you made a point in your opening, in that it is so important for all of us as team members working on cancer patients to come at it from a team perspective, and so the connection there is that everybody has to know their biochemistry. Everyone needs to know the how the mechanism of action of our therapies and also the conventional therapies work, so that we all can work as a team and as a unit, working for the best interest of the patients. So the connection is I think is biochemistry and understanding those points. And then also, I don't focus so much when I'm treating patients on what may have been the cause. we move forward, but as people are finished and we're moving through recovery and remission, we certainly want to look around their environment to see, are there things like, do you have a bag of glyphosate that you sprinkle with your open hand on your on your lawn? Maybe that might contribute, but that's not something that that I tend to focus on. Yeah.
Got it. So from environmental biochemistry and this, sort of cancer care, you're talking about the connection of, we always have to remember our biochemistry, the mechanism of action, not only of our natural substances, but also of chemotherapy, radiation, and always remember the person's biochemistry and how that body's working. So I think that's amazing. So I want to jump to something then. You work with oncologists and you work on oncology medical teams. And as you were saying, that approach is so important that we all remember. What are the greatest concerns when you're working with oncologists? What do they have any concerns about working with complementary care practitioners like naturopathic doctors?
Yeah, and these next 4 or 5 answers are really important. I know that I'm speaking to a good deal of practitioners out there, and so I think if we can be open and we can actually hear, we can work in a more integrated way with our fellow practitioners who are trying to get people well. So in background is that I have for the past decade worked alongside, as you said, with oncologists and oncology teams. And so here are some of the things that I've heard is that that naturopaths or alternative practitioners are prescribing against the protocols. For example, sometimes they'll go to an oncologist and the oncologist will tell them to do something in their plan, and that naturopaths or alternative practitioners will say, well, don't do that, only do a portion of that, which leads to a huge conflict and also a big turnoff for oncologists to ever work with any practitioners, naturopathic practitioners. So this makes the patient second guess, second guess us, but it also makes them second guess their oncologist. And patients need to be all in, and as we all know, need to be all in their plans. Prescribing may interfere with, or it could be in theory, but may interfere with the effectiveness of the drug that's being given, if it's a chemotherapy or even a radiation. So we know that very much so that that oncologists, all the oncologists that I've worked with, really, for example, if patients are being given alkylating chemotherapeutic agents or radiation, you don't want to be doing really large quantities of antioxidant supplements, because it counters the effect of exactly what the therapy is supposed to do. And the other thing is, oftentimes, I love everybody. I love you naturopaths, but sometimes we are very lazy about researching, again, mechanisms of actions. We have to be informed. Cancer is no joke. Cancer treatment is no joke. We have to be informed about what the mechanism of actions are, what the contraindications are, what the notable side effects are. And sometimes we just aren't. We just say, oh, this is good for this, so might as well give it, without taking into consideration the other batteries. And then the last thing is that the attempt to cure cancer, or to treat cancer while patients are also are doing a conventional protocol. From my standpoint, and this is just in my opinion, and what I do is I don't treat cancer. I try to treat side effects safely and effectively. I try to increase quality of life, and I try to go after the immune system very safely and effectively. But I am not treating cancer. And we don't have enough data and guidance to figure out protocols that are safe enough to do that. So,
you brought up so many great points to back up and touch on. First of all, I think what's so important, and you mentioned it, is the patient themselves. And if you have an oncologist that is giving you this advice, and then you go because you're interested and you're all in your health, and you're getting second opinion and or more complementary care, and that particular practitioner poo-poos perhaps what the oncologist is doing, or as you said, only do half of it, I think that causes that concern and confusion in the patient, which I think does a lot of harm when it comes to the fact that they're probably scared as it is, and now wondering what to do. So always having that patient's best interest and truly working in a team perspective, I think is very important. And as you said too, I just want to, there are, I think patients come in. I've seen patients, myself come in, and because they heard it somewhere, somebody told them about antioxidants, high dose curcumin, et cetera, they have cancer themselves. They're coming in and they have self-prescribed because they read about it on the internet or their friend told them about this. And so we have an opportunity to, dossier, once again, clear that up. And also get very specific about dosing, and contraindications, everything you said. But here's my big question after all of that. Dr. Price, I probably am on Facebook maybe 0.7 seconds a day. And mostly it's
good for you.
So some of these chat groups that our profession has. And I saw a question come through the other day that it bothered me a little bit because the question was from a licensed naturopathic doctor, and they happened to mention that, gosh, they've been seeing more and more people with cancer lately, and they were fairly undereducated, and they were sort of shouting out to the forum, where should I go to get more information? So that's my question. Where do these folks go to help prepare themselves to prescribe more safely and effectively and ultimately do no harm?
So I have two answers for that. One is you go to the literature, go to PubMed and other secure, valid, credible literature sources, and you dig in. And when you start digging in, because you'll understand the volumes of what you need to know. And so that leads me to my second answer, which is my real answer, is that within our profession, we have, there are some people that do general care, primary care providers, and there's some people that do pediatrics, and there's some people that do more neurology. And there's some people that have been trained to do more complementary cancer care or oncology. And so I think the responsible thing is to send them out to a specialist, and that's a specialist within our field, because again, cancer is no joke. Immunology and oncology are fields that are very complex, and again, we may want patient load. We may want to increase our patient load, so we want to take those patients. But please, these folks are in a fight for their lives, and if you don't understand the conventional treatments and the way that our treatments are interacting or way they may behave, and one cancer is not another cancer is not another cancer for sure. You can't just treat cancer. It's cancer, and I'm going to just treat it. You should. My personal thought is please refer to a specialist that has that.
Yeah, and for those of you that don't know, so a website that you can go is oncanp.org, and then hopefully that will be an extensive list of the folks that are licensed naturopathic doctors that have taken extra schooling in precision and specialized care for oncology, and that's what they do day in and day out. So that would be a great resource.
Yep. That's a good resource, and there are other folks as well who have had different training. Like I'm not an onc A&P,
Right.
but I am, NIH fellow. Yep.
So yeah, so we're going to talk about the NIH fellowship because I think that's really important, and then we're going to get into just telling folks the supplements, the nutrition that you do utilize when treating cancer patients. So this National Institute of Health Research Fellow in immunology and oncology, that's pretty impressive. You studied what, the polysaccharides of medicinal mushrooms, correct?
Yep, sure did. Yeah.
Yeah,
So
talk about
what'd you say?
I said, yeah, talk about that.
Yeah, so that was that's what I had been waiting for for graduation, since graduating from Bastyr. So in 2005, I was awarded a 2-year grant, and that 2-year grant started out by looking at Trametes versicolor and the polysaccharides, and I believe it was the start of looking at the mechanism of action on receptors. So we looked at the CR3 receptors on macrophage, or I did, and also the toll receptors on macrophage as well. So you can imagine that within 2 years, in 2 years of with basic science research, it's hard to get a good amount of data to either publish or to really understand anything. So I applied for an NIH T32 research project, which extended my stay in research and on that research team for until about 2010 to 2011. At that time, I added not just Trametes versicolor to my studies, but also some mushroom called Hericium, which is a lion's mane, and also reishi. And the reason why I personally added those is because the ethnomedicine states that they're all medicinal mushrooms, but they've all been used very differently for different reasons in Asia. And so I kind of wanted to know, here we have these polysaccharides, and let me back up for a second, is that the polysaccharides are big sugars with a protein core from medicinal mushrooms. What we know is that those polysaccharides is attached to receptors on immune cells. And the 4 immune cells that we know that there's activity on are macrophages, natural killer cells, CD8 cells, and T helper 1 cells. And in attaching them, they make those cells more aggressive, and also they send signals out to produce different types of cytokines like IL-6, IL-1, tumor necrosis factor as well. So these agitated cells, which normally would go into a microsystem of or microenvironment of the cancer and kind of get sleepy because the cancer cells produce cytokines that make the immune cells, like, yeah, I'm tired, I'm not going to do anything. But they're agitated, and so they're so agitated that they actually do their job, and which is fascinating. Now, they don't increase the number of white blood cells or the immune cells, but they do, for the ones that are around, they increase their recovery rate, and then they also increase the aggressiveness. And this is the interest. This is the huge amount of interest. Now, we weren't the first people to do this. The studies had been done on GI cancers for about 45 to 50 years, I guess probably 30 years, 35 years before we were doing it. And in fact, in Japan, the government supplements chemotherapy with a product called PSK to be used at the same time as chemotherapy to help the immune system stay nice and strong. So getting back to my story, I wanted to know exactly how these, where and how these polysaccharides were acting. So I was looking at the receptors, but I was also wondering what's the difference between Hericium as opposed to Trametes versicolor as opposed to reishi. And I talked my way into Walter Reed, a chemist down at Walter Reed, who fractionated polysaccharides for me and then sent them back. And so I had enough to do a small test to see, sure enough, the size, the different size mattered. Unfortunately, I didn't have enough, and it would have been thousands more dollars. And my research, my research eventually was finished. But so that's what I did. It was a delicious piece of research, and I loved every minute of it. Yeah.
Yeah, well, congratulations. And it certainly has informed this path of yours to this complementary cancer care. So getting into that, what are some of the supplements that you use in your practice with cancer treatments and cancer patients?
Yeah, and I'll just say it as a caveat is in general, because each person is different, right? Based on their comorbidities, who they are, their deficiencies coming in, etc. So big ones.
It's interesting that you say that. And I mean, it's such a point that we all know. But for example, I had a mentee of mine email me today, and it was a question about a patient who had a condition. And she said, I run these labs, they come back fine, so I get stuck. What should I do? And this is basically the email, verbatim. And I thought to myself, because I love to help my mentees and be there, have been practiced for as long as I have. But you know what? For me, I was like, I have nothing to say to you because I know nothing about her. I know nothing about other contributing factors. I know nothing about her history. I know nothing about what else informs her environment. I know. And so it was such an interesting kind of even catch for me. And then that was the real talking point and teaching point for my mentee, is that I can't just tell you about amenorrhea and when you get stuck, you got to tell me about your patient because they inform us the best. So You're right. And especially cancer, certainly not protocol driven. Everybody is so different, but thank you for bringing that up.
Yeah. So some of my favorite supplements to use are some really basic ones, and then some that people probably have heard of, and then maybe a couple that folks haven't. So good old fatty acids, omega-3 fatty acids are, excuse me, really important. Turkey tail as one, of course, because I believe in it because I saw what the effects were on in labs and also in clinical, which was clinical was part of the research too. There is a supplement called My Community, which is a combination of mushrooms. I do like using Hericium, lion's mane, especially for recovery with brain fog. D3. I mean, there's definitely the research is there with regards to the immune system. I love resveratrol. Resveratrol has got a ton of great information. And again, resveratrol would be definitely, resveratrol and also the mushrooms would be definitely some that would be used in some cases and not in other cases, depending on cancer type and treatment. And then there's another supplement that I tend to like to use called fucoidan. And fucoidan is, you've heard of it before. It's a seaweed, a brown seaweed that has, again, another form of a polysaccharide, a little bit different from structure than the mushrooms, but some pretty good research and data that's promising. That looks promising, and a good, so for folks that wouldn't turn to food, a good multi-mineral formulation too. So yeah.
Great. That's a lovely general list when it comes to these cases. So supplement by definition, right, is to add to something to enhance or make it better, right? So we're adding to the entire picture. But what I think you do mostly, I want to talk about this, what I think you call therapeutic directed nutrition. So the whole culinary aspect, the whole food aspect with patients. This is your primary treatment, isn't it?
It is.
How did you come to that being? I mean, because a lot of people are like, protocol, what can I, what supplement? But food is foundational, dietary. You look up diet in the dictionary, it's habitual nourishment. How did you get to this being your primary treatment for cancer patients?
Yeah, so about 3 years in to seeing patients, clinical aspects, and then also in practice, clinical trial aspect in practice, I found that more and more people were asking, but what can I do about food? What do you know about diet? Can we talk more about a diet? And so there was a need for it because it wasn't being met. And so what resulted was I started doing, again, my own research in collecting data on the effects of individual therapies, radiation, surgery, specific chemotherapy, on nutrient alterations, and then came back to, well, what foods had those nutrients in them, and then finally wrote my first book, which was co-authored. I co-authored my first book with Susan Ginn's, Cooking Through Cancer Treatment to Recovery, and so the patients wanted it, and then secondly, food was in nutrition. While there were nutritionists, they still weren't giving specific information that was detailed for the patient. And in fact, some nutritionists were giving, within the hospital groups, were giving contrary information to even what the National Cancer Institutes were prescribing or suggesting for patients. So there was definitely a need. And also food, in using food, specific foods consistently. And now I'm not talking crazy. I'm not talking like juice 5 pounds of carrots, while you are on Cytoxin or anything like that. It's consistent use of foods, kind of like what happens in the blue zone areas of the world. Those the places where there's longevity and there's actually no chronic disease processes. They consistently have these fresh foods, these foods that are really high in antioxidants and phytonutrients and flavonoids and all those things. So this is my model. This was my model moving forward, but it was done in more of a specific and intentional way. And it's still definitely a work in process. But I'm really excited about the data that I've collected.
Yeah. That's great. I know that I think there's 2 schools now, you can correct me if I'm wrong, that actually have culinary medicine courses or even a degree in culinary medicine.
I think there's.
Go ahead.
Oh, I'm sorry. Glitch a little bit. I think there's like 4. Yeah. I think there's 4 colleges that are offering at least curriculums. One in New Orleans, and then there's the other 3 are in the East Coast. Yeah. So it's exciting. But again, those folks are, which is fantastic, plant-based diets for cancer folks. But we still haven't even tapped into how specific diet can affect specific treatment protocols, or how it can support specific treatment protocols. And I wanted to make a mention of this. This is how fantastic nature is. There are a lot of genetic mutations, right, that go on. We know that there's the MTHR gene mutation, and that oftentimes people will be diagnosed with that, and they think, oh my gosh, the only way that I'm going to be able to utilize folate, not folic acid, but folate, is if I take a supplement. Now, a good supplement is fantastic, especially if you're addressing an issue, specific issue. But here's how wonderful nature is. Folate, we say folate, but folates exist as a group of molecules. And each of those each molecule in that group is a little varied, so that mutations in genes, in enzymes, can actually utilize one of those more effectively. And so it's the same thing with cancer patients as well. When we start using food Food has such a complex array of nutrients and a complex and varied molecular structures of compounds that the body will be able to choose and figure out what it can use. So we need to use nutrition more. It's fantastic. Nutrition
Yeah.
is fantastic.
Did you come up with therapeutic directed nutrition, or was that something? Did you come up with that?
I might have, but I'm not
Yeah.
sure. But it described exactly what I was doing. Yeah.
Yeah, there are some things that I use that I'm like, did I come up with that or did I steal that from somebody? It's like I don't know anymore, but
Maybe I heard it someplace. Yeah.
so it's different
It's
than
a good
just like
description.
whole foods diet. You're really actually prescribing in like you say, a therapeutic directed way when it comes to these cases using food and your culinary. Okay, great. So talk to me
Yeah.
more about
Did
your
you want an
books.
example?
Yeah, give me an example, and then
Yeah. Okay.
what?
So here's an example. Two examples really quick because I know that you want to be able to open up for questions. Okay. So Velcade and Taxol are two chemotherapies that are used. One multiple myeloma, the other one is commonly used as in combinations in breast cancer and some other places too. Those two have about a 38% chance of patients developing chemotherapy-induced peripheral neuropathy. Velcade's a little bit higher. There's correlation between the diminishment of L-glutamine, but also of branched chain amino acids that seems to correlate with the development of peripheral neuropathy. So in those cases, you think to yourself, okay, what are the factors that I could, what can I do on a micro and macro level to prevent that from happening? Of course, you could have folks take L-glutamine, and that's great. That's wonderful. But you also can say, look, you want to increase your amount of branched chain amino acids because branched chain amino acids supply the nitrogen that forms the L-glutamine, and then also carnitine is involved in it. So listen, I want you to increase your amount of in your diet of lima beans and chickpeas, eggs, fish, and game meats. So I started on a scale, going from plant-based to more, meat-based. Another example would be adriamycin and Herceptin. Again, two different forms of chemotherapy or immunotherapies, and so they have different mechanisms of action. But both of them have the side effect, the predictable side effect that small amount of patients affected, but still a predictable side effect of heart, causing some damage to the heart. So you want to make sure again that you have, and I'm really condensing this down. But you want to make sure that your omega-3 content and your plant sterol content and your L-arginine content is high in foods that they are consistently eating during therapy. So things like nuts and fish and sesame seeds and seaweed. All of those things have those items in it. And don't be fooled that you need large doses of these things. You need consistent doses. In immunology, you only need a small dose to affect physiology and function. So
Consistency over intensity, definitely. And looping back to your very first statement, almost, if you want to learn about nutrition, take a biochemistry class. I mean, and vice versa. If you want to learn about biochemistry, take a nutrition class. So full circle here. So both of your books have to do with food and nutrition, correct?
Yeah, and I have 3 books now. So I have Cooking Through Cancer Treatment to Recovery. I have Prostate Cancer, Thriving Through Treatment, and then Breast Cancer, Thriving Through Treatment, which will be published on June of 2019, all by Demos Health Publishing Incorporated in New York City. Yep.
Great. Well, congratulations. That's thrilling. And I know that your first couple books have sold, I mean, what, over 20,000 copies in its first year. So incredible resource, especially for the patients that are going through this.
Yeah, it's in the first book sold to date about 45,000 copies. So we had well, we didn't have a partnership, but a pharmaceutical company that was interested in promoting natural health. Also, developed a partnership with the publishing company and kind of relabeled some of the book, and so that's been great. That's been really great. Yeah.
All right, before we open it up to questions, if there are any for today, because you've covered so much. I mean, we're talking about advice for working on, oncology teams, about remembering the biochemistry mechanism of action, food as medicine to its nth degree, supplements, clinically studied, evidence-based, get into the literature, supplements recommended for thriving to treatment when it comes to breast cancer, prostate cancer, or I guess any cancer this webinar could be called. So could you just give about, your words and wisdom to the practitioners here that are listening about, anything guiding when they're treating cancer patients? Because you've had over 20 years experience, correct, in this area? Yep. So let us have it.
So one is, so I'll say one thing and then I'll tell just a brief story, is that don't be lazy, be curious. So do your research, do your homework. We can do so much better than just giving short, quick answers off the top of our head to patients with such devastating diagnosis. I had a patient, his name's, well, I can't tell you his name, but anyway, he came in, he was diagnosed with stage 4 prostate cancer. They couldn't find the primary cancer, but the secondary cancer had developed in his lung, or the metastasis in his lung. And so he followed his oncologist's advice, but he and his wife researched, and they came to me as well and researched and did their due diligence, and they did everything that they could do in a very safe and researched way. And and he went down to MD Anderson and got a third opinion. And he, one day he came back and he said, Dr. Price, he said, I'm Ned, no evidence of disease. And he says, I've been in apparently remission for the last 6 months. And I said, that's great. And I'll just call him Stan now. I said, that's great, Stan. And I said, I'm so happy for you. And he says, yeah, they don't know what to do with me because they haven't, this was so unexpected, and they don't have any protocols. And then I said, well, what do you think it was? And this was about maybe 6 or 7 years ago. I said, what do you think it was that did it? And he says, there was nothing, there was no one thing. It was 1,000 points of light. We're not saviors, we're team. So treat medicine as a team.
I love it. I love it. Okay, we do have plenty of questions. So I'm going to read them off to you. And if we could try to get through them, let's just, I don't want to guide your answer, but we'll try to get as succinct as possible so we have a chance of correcting or getting through, considering all of them in the next 15 minutes here. So one question comes from Gabriella. What amounts do you consider high dose when it comes to antioxidants, what we were talking about?
Okay, so vitamin C RDA is something like 57 or 67, and in a supplement capsule, it's 500 to 1,000. And so I just wanted to say that as a perspective. So a slice of cantaloupe, for example, is going to have actually about 67 milligrams. Oncologists are usually not comfortable with patients taking any more than, if it was vitamin C, for example, 500 milligrams of vitamin C. When you go over, when you're going up to, because it's nothing for many of us just to take 1,000 milligrams or even 3,000 milligrams of vitamin C, but but they began to get really uncomfortable with, things over 500 milligrams for vitamin C. Maybe, for turmeric and curcumin, also something depending on what the formulation is, because I know, in the concentration or if it's standardized.
And so in that high dose, that's what we're talking about with certain conventional chemotherapy agents, correct?
Just certain ones, and you got it. That's the other thing. Alkylating agents are the main ones that we would be concerned about. Yeah.
So then we have a question from Paul. What cancer tests would you do to monitor a patient's progress?
It just like we said before, is that's a really general. It's like, well, what kind of cancer are you talking about? There are cancer antigens that folks use, CEA, C2725, et cetera, et cetera. But those are not, they're very sensitive, but they're not specific. So I am not treating cancer. I help with the side effects and the quality of life. I leave monitoring to the oncologists. So personally, I wouldn't do that. But what I do know is that the oncologists, some of the oncologists use that kind of tracking as well as imaging.
Okay, great. That's a great answer. All your answers are great, by the way.
Oh, thank you. Your check is in the mail.
I got 10 more minutes to rack up some bucks here. Hold on. Okay. So, which mushroom brands do you prefer? And then the person went on to say, from what I understand, hot water extracts are ideal. Is that correct?
Well, no, I don't. So first of all, I have a bias to Paul Stamets, fungi perfecti or immune defense, just because the research that we did was on his product. So again, well, I know it works, and so I use it, and I like his formulations. Paul's been around for a really long time. He's been someone who's really been waving the flag of pay attention to these supplements. And the second part of the question was what?
Yeah, from what I understand, the hot water extracts are the best.
Yes. So in visiting Paul's laboratory and his facility numerous times, the polysaccharides in the young mycelium are the things that we want. When we go towards the tinctures, we're not getting out as much of the polysaccharide as we would if we did a water extract. Now, here's another thing: is that Paul, if you're doing it yourself, then yes, it's going to be a rinsed water extract. If you're talking about Paul doing it, he's got a whole different mechanism of rinsing and extracting and then drying out the mycelium. So
okay.
But on a general basis, I go with capsules.
Do you recommend diindolylmethane DIM or indole 3-carbinol?
Say it again.
Do you recommend the supplement DIM or diindolylmethane or indole 3-carbinol?
Yeah, this is a really interesting question. So I do recommend. Well, it all depends on who the people are, and I'll tell you how I usually use it. There are some women that have breast cancer and they cannot tolerate the aromatase inhibitors or the tamoxifen. In fact, it causes increases of hot flashes, irritability, all kinds of things, and they go off of it because they can't tolerate it. It decreases their quality of life. And so they asked me, well, is there anything else that I could help with regards to processing out estrogen faster? And that's what I turn to. But I do tell them that it's super important to know that we don't have statistics and data with regards to DIM, information, so that I could say, yes, it will give you this much protection, or it will decrease your estrogen levels by this much. So I think that's really important to let people know. And yes, I do use it.
Okay. I think my dog Lainey felt it was very important for people to know that too. So, because we just heard her in the background, just rubber stamping everything that you were saying. Okay, last question here, and it's a twofer. Could you please tell us the dose of fatty acid supplementation that you recommend? So how much omega-3? And also, could you spell the name of the brown seaweed supplement?
I know it's a weird name. So the omega-3 fatty acids, again, in general, I recommend 1,000 milligrams 2 times a day. But
Okay.
it all is going to depend on comorbidities. It's also, and as we know in cancer treatment, your white blood cells, red blood cells, and platelets may be affected. We do know from research that platelet aggregation is normally affected at quantities of 7 grams or over of fatty acids, but that can change. That can differ too. So that in general. It all depends on the people or the person and where they are at that particular time. Now, the fucoidan is spelled Fucoidan.
Yes. I was going to give it a whirl, like from my head, thinking, okay, I know I've seen it a lot, but can I spell it? Like it was like in the spelling bee or something. All right, Dr. Price, thank you so much. That is all of the questions. Hang on. I got this, just came in. Information on clients taking estrogen blockers. Any information? And then also, same person here, Dr. Price. What was it again that you said about brain fog as a result of cancer therapies?
Okay, so I'll answer that one, and then I'll have to get clarification on the last one. So, hericium or lion's mane is a traditionally used medicinal mushroom for neurological conditions. And I don't have enough time to tell you the other stories with regards to Merkel cell carcinoma, but what we're seeing is that lion's mane seems to be very good with helping in reducing brain fog after treatment and attention and focus and such. So and then you asked about anything about hormone blockers?
Information on clients taking blockers.
That don't want to take blockers? I'm sorry.
Yep, I don't know. The question is just stated information on clients taking estrogen blockers. So it's a pretty vague question, I should say.
Yeah, because that's a big, giant volume there.
That's not a fair question. It's too big.
Yeah,
sorry about that.
So information is always changing on hormone blockers and aromatase inhibitors, but the data is there that there's some kind of protection. And for some women, for some women, they don't experience the debilitating side effects, short-term side effects. For others, they do. And there are also long-term side effects on those too. But the deal is that there is data and statistics, and I'm sure somebody out there is going, no, but they're poison. Here's the unfortunate thing is that we as a community and even a complementary cancer care community have not gotten it together to collect data that will help to guide us in our decisions for our therapies. And we've got to do that before we can say, well, that's poison, you shouldn't take that, because what else is there? We have to be responsible in what we tell our patients to be doing, and not conflicting and confusing in conventional protocols.
Yeah. Bryce, thank you so much. You obviously have a way of doing incredible research, which is so important in this area, but also just opening up your mind and being mindful about the process of working on a team. And I think you've given us some great points. Really nice supplement list when it comes to generalized cancer treatment, but encouraging folks out there that are watching to really get in there, do your research, and by all means, if need to, refer to somebody like you who's been doing this, is well informed. So I really want to thank you again for your time, for your information, for all that you do. Remember, folks, 4 lucky folks that participated live in this educational webinar from Fullscript are going to get a copy of Coping Through Cancer Treatment to Recovery, her book, and you've got more coming out. So we're going to keep an eye on you. What is the best way that I can show people? I can tell you right now, I got it here, your blog and your website, drlisapricend.com. Stay up to date with everything Dr. Lisa Price. All right. Thanks all for sharing part of your day with us. We'll see you next time.